perform wrist extension, the axis of rotation is the triquetrum. The stationary arm is placed in line with the axis of the ulna, and the mobile arm is placed in line with the fifth metacarpal. Go ahead and extend. (75°). To test ankle eversion range of motion, the axis of rotation is the midway point between both malleoli. The stationary arm is placed in line with the lower leg, the midline of the lower leg, and the mobile arm is placed in line with the second metatarsal. And it's in the frontal plane. Go ahead and evert. She has 10 degrees of eversion. Normal is 18. To perform cervical rotation with the inclinometer is placed on the center of the forehead and it is leveled out to 0. I will ask the patient to rotate her head to the right side. Patient, please rotate her head to the right side. (75°). Normal is 80. 5. To manual muscle test the anterior deltoid, I will have the patient raise her arm to 90 degrees of shoulder flexion and slight supination. The origin is the anterior and lateral 1/3 of the clavicle, and the insertion is the deltoid tuberosity. I will stabilize at the GH joint, and the humeral-ulnar joint is where I will resist, just proximal to it. Please resist. 5 out of 5. To perform a manual muscle test for the quadriceps, have the patient sit on the table with their legs hanging off the end of the table. The origin for the quadriceps is the ASIS, and the insertion is the tibial tuberosity. The quadriceps perform knee extension in the sagittal plane of motion. I will place one hand under her leg and then resist at her distal lower leg. 5 out of 5. To do a manual muscle test of the rectus abdominis, have the patient lay supine with their hands behind their head. The origin of the rectus abdominis is the pubic crest and the pubic symphysis. The insertion is the xiphoid process and the cartilage of ribs 5 through 7. The action is trunk flexion in the sagittal plane. Perform a crunch. 4 out of 5.